Welcome to the orthoPAC podcast with your hosts Sam Dyer, Chuck Dowell, and Miles Gilbreth. Please join us as we attempt to fill in the gaps between education, current events, and real-world practice. Today we have myself, Chuck, and Miles. Let's welcome Vanessa Smith. Vanessa is a PA who specializes in hand and wrist, and we're having her on today to talk about CMC joint, base of the thumb arthritis, and IP joint arthritis.
So the first most common place to see osteoarthritis is the DIP joints. The second most common is the thumb CMC joint. And how you know that it's the thumb CMC joint, put your palm up on the table in front of you and take your other thumb and palpate let's say you're going to palpate your left thumb metacarpal. So you're going to palpate from on the palm side, you're right at the edge of that thenar eminence, and go proximal until you can feel it move. That's the CMC joint. If you keep your thumb there but move now just a little proximal, you feel another hard bump in the volar wrist. That's the distal pole of scaphoid. But where we palpate the CMC joint is just distal to that distal pole of scaphoid, is right from the volar surface, the palmar surface of the CMC joint. When you go dorsal, you can't get to that CMC joint as well. You can kind of get to the STT joint, which is on your differential when people complain of basilar thumb pain. Maybe you get x-rays and that thumb CMC joint looks pristine. But then you realize, oh my gosh, it's bone on bone at the scaphoid, trapezium, and trapezoid, the STT joint. One way to remember that is base of thumb, trapezium. Right? Base of thumb, trapezium. So anyway, the STT joint is another place to get arthritis that can be managed very similar to thumb CMC arthritis. So if the arthritis is involving any of those joints, it's very commonly osteoarthritis. We don't need to get a bunch of lab work or do any other testing. It's more patient education. When we see more PIP and MCP arthritis or wrist arthritis, we'll think about rheumatoid or inflammatory arthritis, in which case we would get labs to look. And I recently talked to a rheumatologist just because we had gotten some back and forth, like, why did you get these labs? ANA is not helpful. We're like, okay, what do you want us to order? So CRP, rheumatoid factor quantitative, and CCP antibodies are the three things that we order now consistently to evaluate for inflammatory arthritis. Those are things, if they are negative though, and there still is this suspicion for us that this is acting different from osteoarthritis. This is symmetric. This is not just after activities. They've got quite a bit of pain in stiffness in the mornings, and it doesn't seem to be aggravated by use, or it's an odd joint. It's maybe the index MCP joint, and there's no history of trauma. And so there are things that in our suspicion, even with normal labs, we will still send them to rheumatology for evaluation, because you can have seronegative rheumatoid arthritis. After we've kind of addressed that toolbox, then we'll say, okay, if we've tried all this stuff and it's not helping, we can do a cortisone injection, right? That's a definite option. That's also kind of in the toolbox of things that we can use before we get to the point of surgery. There's been some more evidence to come out to show that denervation of the arthritic joint can be helpful and have a shorter recovery period with similar outcomes to arthroplasty, specific to thumb CMC joint, and index or MCP joints and PIP joints. So that is definitely something we are talking more and more about in our practice. And then we get into the whole surgical world. So I think I'll pause there and ask if you guys have any questions.
Not particularly. That was a pretty detailed explanation for CMC. I did like that about, making sure that you're palpating that joint over the volar aspect instead of dorsal, to make sure you're not getting into the STT. I think that was a really good differentiator.
Yes, I explained too, any joint that has arthritis and then experiences a trauma or injury, there's going to be pain there for a while, even if there's no fracture. So we find that people who fall on an outstretched hand and have a distal radius fracture, often that distal radius fracture will heal just fine, but they just have ongoing pain at their basilar thumb from their thumb CMC arthritis. So it just an education point. There is a direct correlation, that the longer you live, the more likely you're going to have arthritis. So it's just part of getting older.
Yeah, so as somebody that has CMC joint arthritis, it really restricts it with certain activities, and then certain activities it doesn't bother. So it's kind of it's just not fun to deal with. So I'm anxious to hear what you have to say about treatments, the surgical treatments and such. I want to ask you about splinting a little bit. So we had these DME things off the shelf, the Comfort Cool splints. It's just
Yes.
like a little sleeve to put on. Have you
Yep.
had any experience with those? And then
Yes.
the second part of that question, you talked about referral to OT, and OT can do these dynamic splints. And is there a functional equivalent or a functional brace that they can make for somebody, or is it more just to hold it still to get the inflammation down? Kind of a static splint. I'm just curious your thoughts on those two things.
Yes. Yeah. The Comfort Cool splints, we have found people enjoy them because of how they help with the pain. The only caveat is the price has gone up and they are not covered by insurance. There's no hard piece or metal stay in them. We have collaborated with Healy Weber. They have a CMC controller splint that is made of a similar material to the Comfort Cool, but it has a little aluminum stay in it that supports the basilar thumb. So you kind of, once you get it on, you kind of pinch it to support that thumb CMC joint, and that gives good stability, but it's also paid for by insurance. So we'll give people the option to try both on, and then they can talk to the DME people, the home medical folks, about which one they want to go with. There's been some literature to come out lately to show that static splinting and orthosis from OT can be even more helpful with pain. That is, in our mind, one of our options to send people to OT, not only eval and treat for arthritis, but also orthoplast, hand-based thumb spica splint, IP-free, with thumb in position of function. And people know that they can use that, put that on when the thumb is really flared or if they're going to be doing a lot of work. We have had some people who use their hands quite a bit and found that the Comfort Cool really just wasn't enough support. Well, then we'll have them get one from OT that is much more rigid support. So in our mind, we have them all as options, talk through them. Maybe we'll even try them on for the patient or send them down to home medical to say this or this or this, kind of an option series, and then they can decide which one. But again, that's a tool in our toolbox. So we tell them you don't have to wear this forever, but when it's sore or you're going to be using your hand a lot, get it out and use it. That's okay. The other thing I was going to add to the toolbox I forgot to mention is activity modification. Again, it's just a teaching point. They don't have to come to hand surgery to get this, but the concept that every time we pinch and grip and squeeze, every time we use our opposable thumb, all that force goes through the thumb CMC joint. So I'll talk to patients that instead of grabbing the plate out of the microwave where we have our thumb on top and our fingers underneath, put your thumb underneath so that it's more like a blade. And that's how you're going to get the plate out of the microwave. Or instead of gripping your water bottle with your thumb on one side and your four fingers on the other, put your thumb, adduct your thumb, put it right next to your index finger and just cup the water bottle. Just the less we aggravate that joint, that can also help with pain.
Those are great points. I haven't thought about that, and it's a really good point about how you use your thumb when you're doing certain things. Listeners, Vanessa is also the CEO and founder of orthorefresh.com, which is videos and information geared toward primary care PAs and primary care providers for hand issues. Please follow the Physician Assistants in Orthopedic Surgery on social media. Connect with us on Facebook, Instagram, LinkedIn, and Twitter. Please subscribe to our podcast. If this has been helpful, please take a moment to leave a review.